Good evening. What? Good evening, everyone. Welcome to the board meeting for September 21st, 2022. If you'd like to speak to the board, please complete a card, or if you're at home, please fill out the Google Doc form. Si quieres hablar con nosotros esta noche, puedes llenar una cartita y dársela a Evelyn. Si estás en casa, puedes llenar la forma que está en Google Docs. If you need Spanish translation, we have translation available. Excel is here. Si necesitas traducción, tenemos a Excel aquí que puede ayudarlos. Si estás en casa, puedes llamar al 978-990-5137 y presiona 8377-041 y el signo de número para la contraseña. If you're speaking at the board meeting, we'd love to hear from you. Just want to remind you that everyone gets 3 minutes unless we have lots and lots of people, then we will change that time. Also, if you're here to speak on any of the consent items, they're voted on simultaneously, so you need to let us know so that we can pull those out from the consent item. And let's okay, Evelyn, roll call, please.
Trustee McAvoy,
Present.
Trustee Wells,
Here.
Trustee Lawson, here, Vice President Marquez, here, President Diaz-Locke.
Present. Again, welcome to our board meeting. We're glad to have everyone here this evening. Do we have any changes or modifications to the agenda this evening?
I was going to propose we move the 8.4 approval of personnel changes to consent.
Do we have any other changes? Hearing none, can I have a motion to move the approval of the agenda?
So moved.
Second.
Roll call, please.
Trustee McAvoy,
Aye.
Trustee Wells,
Aye.
Trustee Lawson. Aye. Vice President Marquez. Aye. President Diaz-Locke.
Aye. And now moving on to oral communication. Do we have any speakers this evening, Evelyn?
Yes, we have Chris Robel.
Okay, can you hear me? Okay, I'm starting my timer. Thank you, everyone. So as discussed with Dr. Baker this afternoon, and some email correspondence with Alyssa as well. I'm very concerned about the district's practice of using public assets to share information about Measure S. Specifically, the website banner, which has on the very front page says November ballot will ask voters to modernize their local elementary schools. And then the newsletter, which is of this afternoon, has over 7,300 views, says Measure S to address school repairs and updates, and then has a link to the website and FAQs. So I have looked into I'm sure you're familiar with the California Education Code, Article 2. So the two sections that are relevant here, Section 7054 and 7058. First of all, state unequivocally that there's a blanket prohibition on advocacy related to bond measures, full stop. Second, so it would be illegal, for example, to use the district website or the superintendent's newsletter to urge support of a ballot measure. So, and you can read through the information and make your own determination whether you think that's urging support. However, if you do look at Section 7054B and 758 together, it does say that public resources can be used if two things: the information provided constitutes fair and impartial presentation of the relevant facts to aid the electorate in reaching an informed judgment regarding the bond measure. And then secondly, the forum that's under control of the district is made available to all sides on an equitable basis. So on the other side, right, full transparency. So my request to to Alyssa and to Dr. Baker was to afford me the opportunity to provide facts in the same, neutral, fair and impartial facts that would aid voters. Dr. Baker was not amenable to that. So the other option, of course, is that the district could do what Sequoia Union High School District and others do, which is not use the public district website and the newsletter and other public assets to promote, share information, if you want to use that word, for communicating about the bond. So Dr. Baker said he would provide an attorney letter to help me understand why that interpretation is incorrect, and I have sought input from others on this who share my viewpoint. And so I am really urging you to please take a very close look at this as a board. And this is an important issue, just like the misleading ballot question that I remain concerned about. And I ask that the board please direct Dr. Baker to remove the page from the website so you're not talking about the bond measure. There's campaign websites, and stop the newsletters to any commentary about the bond measure in the newsletters. Thank you very much.
Thank you very much. Just for clarification, the district does not engage in any such activity having to do with elections. All our employees are informed of what they are not supposed to do at work. Being that you're quoting the ed code, I would suggest that Dr. Baker contact our attorney and let him get back to Mr. Roble. And normally we don't reply when it's on such a this, but just for clarification, thank you. Okay, do we have any other cards this evening or oral communication?
Barbara Arena.
That's me. Hello there. I'm just saying hello. I'm a new teacher over at Hoover, and I just want to say I have third grade. I just want to say how excited I am to be in the district, to work with every student as a precious treasure. And I just wanted to say I'm so happy, and I just wanted to meet all of you. So I'm just saying hello, just saying how excited I am. I've been teaching for hundreds of years, so I'm every level. So I'm really ready for action, and I know I'm getting it over there. My philosophy, which I think you will all agree, is just to come with love. Love heals everything. So I just wanted to say hello, that's all. This is me. Okay, thank you. Thank you all so much.
Thank you. It's nice to meet you. So no other cards or form names in the form? No? Okay. Moving right along to item 6, bond program consent items. Can I have a motion to move this item?
So moved.
Second.
Roll call, please.
Trustee McAvoy.
Aye.
Trustee Wells.
Aye.
Trustee Lawson. Aye. Vice President Marcus.
Aye.
President Diaz-Solcom.
Aye.
Thank you, guys.
Thank you, Will. Now moving on to the regular consent items, which include item 8.4. Can I have a motion to move those items?
So moved.
Second.
Roll call, please.
Trustee McAvoy.
Aye.
Trustee Wells.
Aye.
Trustee Lawson. Aye. Vice President Marcus.
Aye.
President Diaz-Solcom.
Aye. Moving on to the action items, item 8.1, recommendation regarding adoption of resolution 13, authorizing electronic meetings of the Board of Trustees during state of emergency pursuant to Government Code Section 5495(3)(e). And we all know what it is, so can I have a motion to move this?
Second.
Roll call, please.
Trustee McAvoy.
Aye.
Trustee Wells.
Aye.
Trustee Lawson. Aye. Vice President Marcus.
Aye.
President Diaz-Solcom.
Aye. Moving on to 8.2, recommendation regarding adoption of Resolution 14, resolution to adopt the GAN limit.
Good evening, members of the board. Tonight, we are presenting resolution number 14, adoption of the GAN limit. The GAN limit sets appropriation limitations for public entities, including K-12 schools. This year, after going through unaudited actuals for the 21-22 school year, it's noted in the backup documentation that we exceeded the state prescribed GAN limit of 1.880 million. With this resolution, we will adopt a new appropriations limit that will be forwarded on to the state superintendent of public instruction within the next 45 days. With that, I'm happy to answer questions or hand it back to the board.
Do we have any questions or comments? Hearing none, can I have a motion to move this item?
So moved.
Second.
Roll call, please.
Trustee McAvoy,
Aye.
trustee Wells,
Aye.
trustee Lawson. Aye. Vice President Marcus,
Aye.
President Diaz-Solom.
Aye. On to 8.3, recommendation regarding approval of the 2021-22 unaudited actual financial statements. And Rick?
Good evening again. Tonight, I am presenting the 21-22 unaudited actuals. Perhaps if the presentation goes. Per Education Code 42-100, on or before September 15th, the governing board must approve the actual financial condition of the district for the previous fiscal year. As noted, today is September 21. We did notify the San Mateo County Office of Education and sent our completed unaudited actuals last week, letting them know that the signed certification would be coming after tonight pending board approval. We also complied with California Education Code using SAC software to provide our unaudited actuals. As you saw in the budget book, with the approximately 160 pages that we're required to submit to the state of California. What are the unaudited actuals? They are the year-end fiscal report for 21-22. They show actually the revenue that we received and the expenditures that we spent. The final ending balances then carry forward to the 22-23 school year. The next step in this process is working with our auditors. They'll be here, I believe, the third week of October to start the year-end audit, full financial audit of the 21-22 school year. Once that is complete in early December, that will conclude our fiscal responsibility for 21-22. When we look at unaudited actuals, they're often different from estimated actuals that are approved at board adoption or budget adoption by the board. There's a number of factors. This is not an exhaustive list, but I would say these are some of the most common reasons why estimated and unaudited actuals differ, including unanticipated revenue, revenue that was received in a different amount than we were projecting. We had a couple where we got a little bit of extra money right at the end of June that was not there when we were developing the budget in April and May for approval in June. Expenditure allocations, what we expect to spend doesn't often happen. A perfect example of that would be the LCAP expenditures, where we're carrying that money over now. And there's a number of factors for why we didn't spend it, including hard to fill or hard to hire positions that not only Redwood City School District, but many school districts are facing right now as they go through. Another reason is purchase orders are issued before June 30th with the expectation the goods and services will be delivered by June 30th, or the services will be provided and they go into the next fiscal year. And then what we have a lot of this year, partly because of the hard to fill positions are expenditures that were planned for the current year, but will be moved to a future budget year for revenue and expenditure purposes. Next slide is simply a list of our district funds. Fund 01, that is our base fund or general fund, the one we commonly refer to when we talk about budget. On this slide, you can see that we received unaudited actuals $122,234,707, broken up between those different sources of revenue, including our property taxes, federal revenues, state revenues, and our Measure U parcel tax. On the next slide is our general fund expenditures for 21-22. A total of $121,768,738, representing 100% of expenditures. And if you'll notice on the pie chart, approximately 77.5% of our expenditures are to our employees for salary and benefits. I will note that this number would be higher if we were able to fill those positions with employees. And would be up around the 80 to 81%, which most school districts experience on an annual basis. That would also decrease our services and other operating expenses from the current 17% that you see in the chart on the left-hand portion of the slide.
Is that because those are contract workers?
Those are contracts. Those are the 5,000 series.
Yeah.
Yeah, all of our contracts.
Yeah, just real quick, Rick, on that point, because I think that's an important one, because we do get asked about that by the community and staff, is that because of the hard to fill positions, we're not able to hire them directly as employees where they would be in the certificated or classified, and then they would get benefits. So we're hiring them as contractors, as Janet said. And typically that actually costs the district more, but we actually, and it's a different bucket of money. But we don't have a choice, right? These are positions that need to be filled, special ed specialists, teachers, that sort of thing. So that's totally right that we would be much higher if we could actually hire those people, but we're just unable to do so. And the good news is there are these consulting firms that are, contracts that are available. So we are able to meet the needs of the students by this means.
Yes, 100% correct. Thank you. Going into a little more detail on Fund 01, looking at estimated actuals versus unaudited actuals. And you'll see some significant change here with total revenues changing, dropping by about $6 million and total expenditures dropping by about $15 million. And this ties back into the second slide that I spoke about, the reasons why we're experiencing these changes. There was a lot of money that went unspent this year that is going to be carried forward. There was carryovers where they'll be booked as revenue and expenditure in future years. And that played into these totals, as well as something that's not specifically on here, but if we look at individual areas like special education, once again, the hard to fill positions where we're bringing contractors in or not having bodies in positions also contributed to the reduction in expenditures. So you can see that where we at budget adoption, we were showing deficit spending of just over $9.2 million. We're actually showing that we're positive by $465,000 now, which takes some, as we go into our other budget reports throughout the year, the first interim and second interim, et cetera, that'll take some pressure off of those financial reports in terms of being able to report those balances at that time. And we'll talk a little bit more about that in just a moment. But you can see our beginning fund balance and our ending fund balance are almost the same for the total year. Going into the components of the ending fund balance, important to note that we do have legally restricted items on there. There's actually a list of that approximately 9.4 million. It shows 8.9, but we line itemed out the COVID funds for $500,000 that we have identified. So that 500,000 combined with the 8.9 is approximately the 9.4 million of restricted assigned items in our ending fund balance. On page 36 of 181 in the budget book, you can see that the Expanded Learning Opportunities Program, Educator Effectiveness Grant, amongst the bigger balance items that are contributing to the ending fund balance. Of note on here as well is the unassigned unappropriated amount of $3,062,923. And as I understand it, is not often seen in budget presentations for Redwood City School District. But what that was with all of the revenue and expenditure changes, that was money that was unaccounted for, if you will, because of that decline of those two areas. And rather than having, I'll say, an assigned category for that, we left it as unassigned because we were able to meet our state minimum reserve for economic uncertainty of 3%. And we were also able to meet the board mandated reserve of 3%. So this money, as we go forward, isn't necessarily extra money or free money that we can do anything we want with. But as we look at it over the course of the current year plus our 2 out years, an example could be that when we come back at first interim, if you recall, we had a $7.5 million approximate contribution from Fund 25 from RDA money that now becomes a $4.5 million contribution with all other things remaining equal. So this is going to help us as we address some of the issues facing us over the current and 2 out years as required by Ed Code. Are there any questions on that before I go to the next slide? So this slide is a summary of all of our funds, including Fund 01. On the presentation I did at the Student Activity Fund 08, that's for our ASB accounts. That is new this year. In the spring, I believe you approved the creation of Fund 08. And that's simply our donation account from school sites through their ASB accounts. Child development, 12, 13, deferred maintenance, 14. There are some negative numbers in here that you see. One of the things that we're still working on, and we'll bring back additional information in the future, is we had to write off losses from the Sonoma County investment pool into our unaudited actuals. That we are still making sure that everything is correct and everyone, including the county Office of Education, agrees with. So that is ongoing, and we'll provide updates as we get more information through the fall, and certainly at first interim of how we're going to handle that for this year and in the future. So next steps tonight is unaudited actuals approval. As I mentioned, our auditors, Bailey, will be showing up in late October, early November to complete the 21-22 audit, which we will submit in early December. The first interim budget report for 22-23, which is from July 1st through October 31st, will be presented at the December 14th meeting for approval. Going into January, as we often do, eagerly await the governor's budget proposal to see if it will help us in future years. And then the March meeting for the second interim budget report, which then really kicks off budget development going into the late spring and summer for public hearing and adoption in June. With that, I'll turn it back over to the board and happy to answer any questions.
Okay, do we have any comments or questions for Rick?
Thank you for putting together the presentation. I think you answered every question that I had asked around what was in the legally restricted and the fund ending balances. What I was curious was that the decrease in the revenue, that's not a carryover, right? The expenditures are something that we may choose to carry over, but when we look at the general fund and you have the summary of I'm just wondering, how will that show up anywhere else in the first interim, or is it all reflected here in the ending balances and that's the only thing that we'll see reflected in the first interim?
No, there will be some things that come forward even in revenue that will book revenue and expenditures in 22, 23 that we carried over from 21, 22. So that will change somewhat by first interim.
Okay.
As I know Liz and her team, amongst other, are working on plans for expenditures. So that'll be brought into the first interim and updated within time.
Okay. Sounds good. Thanks.
Anyone else? Elisa, are you okay? Okay, good. I don't have any comments or questions. Cecilia and I met with Rick and John. I just want to say thank you to you and your staff for doing all this work. I know you guys have a lot on your plate and it's hard, those hard to fill positions that we have to continue to deal with. So thank you very much for your report.
Thank you.
And with that, can I have a motion to move this item?
So moved.
I'll second.
Second?
Nope, Elisa gets it.
Oh. Okay.
Roll call, please.
Trustee McAvoy,
Aye.
trustee Wallace,
Aye.
trustee Lawson,
Aye.
vice president Marquez.
Aye.
President Diaz-Solom.
Aye. 8.5, recommendation regarding approval of classified fact-finding MOU. And I think that's one.
Are there any questions regarding the MOU before you tonight?
I don't have any questions. You've kept us up to date through the process in various closed sessions. So I think it's good to see it getting finally to resolution.
Yes, I think we're all happy to see that it has gotten resolved. And with that, can I have a motion to move this item?
So moved.
Second.
Roll call, please.
Trustee McAvoy,
Aye.
trustee Wallace,
Aye.
trustee Lawson. Aye. Vice president Marquez.
Aye.
President Diaz-Solom.
Aye. Moving on to 9.1, report from board members and superintendent. And today I'm going to change it a bit. We're going to start with John.
All right, so I chaired the Redwood City Together executive team meeting, which took place last week, and it will be Elisa and Janet who will be chairing the leadership group. And so I'm sure you'll be meeting with Raphael to go through that process and what it will look like for the first meeting. One thing that is going to be taking place, I guess what is going to move forward is the Maria, the Fair Oaks Community Council, is it Fair Oaks Council? Thank you, the North Fair Oaks Council. Ever will be stepping into the leadership group as opposed to the executive meeting group because someone else from the executive council is going to take his place. So that'll be a new change. The other changes are as we reviewed the budget and so forth moving forward, we're definitely in favor of going in the right direction. There are more donations that have been granted to Redwood City Together. So it's now no longer, it wasn't in the red, but it was where we needed to make sure that we got for the donations, for their grants and so forth. So it's moving in that direction. So that's really good. There's some additional Stanford students that are working, alum that are working on research projects, and part of the research project is working with Redwood City Together. So there's some additional, they're not employees, but they are there to support the system. This was our first meeting where it was in person. We did not have the superintendent from Sequoia High School District because there was an emergency in her family. She had to go back down south. So, but overall, it's starting off to be a good year. So, and we talked about the retreat that we were at before the end of last school year, and what that looked like and the results. And I believe that's what Elisa and Janet will be leading the larger group in, are those results. So then that meeting's coming up in another month, I think, if I'm not mistaken. Yeah, so Raphael will be contacting you. That was that piece. And then today we had our site administrator meeting, and it was everybody was there, great meeting. We have decided that we are going to go in person starting at the next meeting. So I think everybody's thrilled about that instead of doing Zooms. And we're going to be having our meetings at Kennedy Middle School, be using the library. So everyone in favor. And then we, all cabinet members were there also giving their updates on their departments. So very effective meeting. And so those are the two for myself at this point in time.
Hey, Mike.
So I went to, and I think you went to this as well, Dr. Baker, but we missed each other, the Mid-Autumn Festival over at the Orion.
Yeah, I was there.
Yeah, I showed up after 7. I had to pick my daughter up, but at least she got to come with me. So that was fun. What else was fun? Oh, we did Don Diaz's retirement.
True.
That was another one that was a nice event over at Garfield. And then I got to go to Clifford back to school night for a little bit last night. Not for the whole thing, but I want to thank Jude and Tiffany for showing me around. We got to visit a bunch of the K-5 classrooms and the special day classroom. And that was really nice. And I met a family there that had a 2nd grader, which of course, doing the math, I was like, how did you get through kindergarten? And they said it was tough, but they were they were just raving about the administration there, the teachers, and their experience now that they're in there. They had just moved to Redwood City. It's the kind of positive experience that we hope that we're building for the community, our families, and the students in our school. So that was really nice to hear, and I just wanted to make sure you guys got to hear that too.
Good.
I think the only thing I have is that Elisa and Dr. Baker and I had a workforce housing meeting this morning.
That's right.
Was that this morning?
It was
so long ago.
You're correct.
That's all I have.
You are correct.
Cecilia?
And I just had another actual meeting with Rick and Dr. Baker.
And Elisa.
Yeah, basically the meeting with Janet and John this morning.
You usually have a lot.
I know. Well, yes, I have not had as many. I've had lots of conversations with people, but not official meetings.
It's good to have a break. And I just
Yeah.
had a budget meeting with Rick and Cecilia and John. Okay, moving on to 10.1, review of Health and Wellness Department vision and plans for 2022-23. And Patrina's here with
Yes,
us.
she is. She's here with us tonight.
Hey.
Welcome.
Trustees, Dr. Baker, and Executive Cabinet. I will be presenting to you guys the Health and Wellness Department updates for last year's school year, as well as for this year's school year. So I'm going to share the screen. Are you guys able to, Are you guys able to see it in the slideshow mode?
Yes.
Perfect. Okay, so health and wellness. So through Sequoia Healthcare District Health Start Initiative, the focus of the Health and Wellness Department is on using the WISC model, which provides school-based health, wellness, and physical education programs with our community partners. So last year, we reconvened the wellness committee that consisted of our board members, district staff, as well as community partners, which are all listed here. And the focus of our committee work was the first task, and the main task last year was on our triennial assessment. And so for the triennial assessment, the district administrators, site principals provided feedback to help complete the assessment, which was about 100 pages of different questions that were asked about what was going on in the district. And the findings of this assessment was categorized into 3 areas: strengths, opportunities to grow, and concerns to address this year. So what this assessment found is that our district communication of health services through newsletters and on our website was great. Our family and community engagement was addressed through parent education series, parent advisory boards, and committees throughout the district. And that diversity and inclusion work was facilitated in our MTSS committee, as well as at district school sites. The assessment also showed that the district has opportunities to grow in building staff capacity and reducing chronic absenteeism and addressing school discipline. And then most importantly, areas that needed to be addressed this school year was included improving nutrition and food access and fostering positive school climate and strengthening social emotional. So as a result of the assessment, you're probably wondering, how are these being addressed? Well, a lot of work has already been started. The first area that the Wellness Committee started to address last year was developing administrative regulations that would outline how the board policy, the board wellness policy would be implemented. And then there was also the need to build staff capacities specifically for physical education. So we have our first professional development opportunity next week on the 28th for our PE teachers who are voluntarily going to participate in this training. And they'll be participating on Wednesday from 3 to 5. And then the LCAP helped put in place behavior analysts to address to help staff create positive interventions to get positive behavior outcomes, which will lead to a reduce in disciplinary referrals. Student services is outreaching to parents in early stages when students are absent to reduce chronic absenteeism. Child nutrition services has been working effortlessly on improving the quality of food by forming committees, visiting other districts, and the menu. And then also through LCAP, we have additional counselors this year through One Life that are helping to address social emotional health. And then also this school year, I'll be starting up the Health and Wellness Committee. And one of the key goals that I want to focus on is increasing social and emotional health for staff. And so that's one of our key components in the work that we'll be doing this year. The triennial assessment is done every 3 years. So we'll continue to follow the WISC model, keeping in mind and consistently implementing our board policy. So hopefully at the next reporting period, so in addition to the work that the Wellness Committee did, the Wellness Department consists of the backbone of the district, which is our nurses. Each year they complete our hearing and vision screenings along with providing first aid to all students and managing compliance of immunization. They also have been with us since the start of the pandemic, and they've been on the front line collaborating with the district office during testing and immunization clinics. And these are just a few pictures here of our hearing screenings last year. The Wellness Department also worked in collaboration with the Child Nutrition Services and will continue to do so. And this is just an example of a food tasting event that took place at one of the school sites last year, child nutrition program. We have worked with partners such as Sunrises Dental, who provided free dental screenings to preschool through kinder students at selected schools in the district based off of their funding source. We have also worked with Vision to Learn, who completed vision screenings, eye exam, and also provided free glasses to students at no cost if they were identified as being in need. And these are just pictures of the dental screenings as well as vision screenings. And then also the Sequoia Healthcare District has funded well over $1 million to the district and its partners. And this funding goes towards district staff, counseling, PE programs, parent education series, alcohol and tobacco, drug prevention education, student mentors, and resilience consultation for staff. And these are just pictures of our PE Plus program as well as our El Centro program that provide the alcohol, tobacco, and drug prevention education. So what are our goals for this school year? So I have a few goals in mind, and I'm constantly adding goals as I communicate with other wellness directors from other districts. But what I do know is that Sunrises will increase its dental screenings of preschool through kinder students from 4 sites to 7 sites this year because they have received additional funding. And then also they will include our McKinney-Vento, our foster students, as well as our new students, our newcomer students that are outside of that grade level, if there is a need for screening. Also, there will be an increase of messaging out health and wellness news through various district and site newsletters. Through the LCAP, there is funding, which 5 sites will receive restorative justice training through Circle Up. There's a collaboration between the Health Wellness Department and CNS to form an advisory committee, which involves district and school staff, parents, and students. And we held our first meeting last week on Tuesday, which went very well. We are working in collaboration with the UC Cooperative Extension and San Mateo County Department of Public Health to provide the professional development for middle school PE teacher, as well as our PE Plus program. And the Health and Wellness Department is now monitoring COVID tests in the district, and we plan to offer a COVID and flu vaccine clinic, which information either will be going out today or by this Friday to get an idea of how many families are interested, as well as staff members are interested in participating in that during the month of November and December. And then finally, which is not included on here, I would also like to, once again, focus on staff wellness. And so I am partnering with community organizations to plan some wellness activities for staff, as well as wellness incentives to promote health wellness for our staff, because we all know if our staff feel good, they make our kids feel good. And it also just increases longevity in the district, and we want our staff to be. So finally, I just want to recognize the different networking opportunities that I've had with the Health and Wellness Department, and also the means of communication that we've had to give out to communicate to staff and to parents. Do you guys have any questions for me?
Any questions or comments for Katrina?
I do. Thank you for the presentation, and a big thank you to the entire wellness team. I had a question. Are you guys notifying parents before the screenings happen? Just curious to know.
Yes, so right now there is vision screenings being conducted by Vision to Learn. And our communication staff has created flyers that have gone out per sites. Our dental screenings begin next week. And so as each site are going through the different screenings, we are sending out flyers to notify parents of that. And Vision to Learn, as well as Sunrise's Dental, also have opt-out forms. So if parents choose for their child not to participate in the screenings, they have the option to do so. And then our nurses will be conducting mandated vision screenings for all of the school sites that are not being screened by Vision to Learn. And that information will also be sent out by the different school sites.
Thank you. And then just one more kind of follow-up question with that. Are the flyers being translated to Spanish?
Yes, Miss Redmond, that's how you pronounce her name, has definitely translated everything that needs to go out. So I run everything by her as well as Jorge, so we can make sure we get it out in English into Spanish to all families.
Great, thank you.
Anyone else has comments?
Thank you for the presentation, Patricia. It is awesome to see all the stuff that is going on with the wellness department. And it is a strong reminder of how much it takes to educate children, especially kids with, in a district like Redwood City that has such diverse needs. The health from dental and vision, and seeing that being offered through screenings and eyeglasses for kids that need it so they can actually see in the classroom. That's amazing. The mental health, the SEL, positive school environment, the focus on restorative justice. Of course, nutrition is an important part, the counseling services, and our staff. They, of course, have gone through the trauma of the pandemic and also the challenges that the kids bring to school each day. I'm sure many of the teachers take that home with them, and being able to have that support is awesome. So again, thanks for the presentation. It's a good reminder that, like I said, just how much goes into educating a kid, how much responsibility this district takes on. And I enjoyed hearing about it.
Thank you.
I'll just say thank you for the presentation, and you've been so busy since you started here in the district. And I think your presentation shows so much of what you've been doing. And just looking forward to, Elisa and I sit on the wellness committee, so looking forward to meeting up with that again this school year. So thank you.
Yeah, and I also wanted to say thank you very much. It's been such a pleasure to work with you this last year, and it's clear that you're doing so much. And I too really appreciate the presentation. And I think the reminder to all of us on this call and all of our community members about how much the school districts do, and particularly our school district does, to help with the overall wellness of our students and staff in the community, and families as well. So thank you. And I'm really pleased to see the renewed focus on our staff. I think that's a really good focus for this next year. I know we've done a lot for students and families, and our staff are equally important because, of course, as you said, Trina, these are the people who are in there every day with our students, and in order to be their best, they need to be their best. In order to be the best for the students, they need to be their best. So I really appreciate that social emotional support for staff this next year. So thanks.
And Petrinia, I just want to say that I really appreciate your positive and collaborative attitude. You are just always there, so positive and smiling. It doesn't matter how hard the problem is, you got that. Yes, we can do it. So I appreciate that. I also, as Elisa mentioned, want to remind us all that it takes a village. And as you can see from the Sequoia Healthcare and all our other partners, the county, what is that, Star Vista, and all the other ones that provide the needed services for our students. I am really pleased to see that we're continuing with the dental checkups. I remember how hard it is for some students to learn because they have a toothache and their parent cannot take them to the dentist, or the child who's trying to read and it's squinting and comes, There's one in particular, a little girl, I remember she got lavender colored glasses that were free, and she was running to me and showed me her glasses and said, "Look, I can see." And she could see the letters. That's what she wanted to tell me. So that is really a positive thing for us, because while the teacher and the staff and the principal and everybody can do all they can to teach, it is those little things that Mike said that get in the way, that toothache, that headache from not being able to see well, that when you remove those barriers, it really makes it positive for the students to learn. And I also want to thank you for your collaboration with the Child Nutrition Committee and the focus on nutrition. I think that's really important, as well as focusing on our staff. I think we were reacting and trying to do our best for our students and our families, as Elisa said, and my colleagues. But let's not forget about the rest, the staff that do the work. So thank you very much. And I look forward to hearing more exciting ideas that you add to your list. Thank you. John, do you have anything?
So Petrina, this is what the Director of Health and Wellness should be doing. It's really grateful to see that you brought this department to where it is right now. It's totally been revamped, and it's something that we had hoped was going to go in the direction, in the manner it was thought to be. You brought together your expertise as an educator, which I know Ms. Kelly and myself really, as we spoke about this position to the Sequoia Healthcare District, really wanted someone with an education background. And it took us some time to get there, but we did. And in speaking very carefully to the CEO of the Sequoia Healthcare District, Pamela Kurtzman, she finally understood what we wanted and why we wanted to go in the manner we did. And it was great that we found you, because we really searched. And when Ms. Kelly told me that we had someone who had not only a special ed background, but the experience that you have had, and to bring forth to really turn this program around for us in the Redwood City School District, I applaud you. This is something that was definitely needed, and we're on the right track. So thank you so much for all you do. You work with every department in this school district, and that is what the collaboration, the cooperation that we were looking for, and we were looking to move this in a direction that would meet the needs of all of our students. So I applaud you. So thank you so much for doing so. And I think Ms. Kelly would like to say a few words.
Gosh, John said everything I wanted to say, but I'll just add a few things. It's, I don't know if all of you know this, but it will be a 1-year anniversary for Petrina joining us as of late November. So when you think through all of the elements that she has pulled together over these past, 10 months now, it's quite remarkable. And she has a gift for coordinating people together, really honoring the viewpoints of others, building relationships with our partners with such finesse and ease. At least it appears that way, Petrina. So I enjoy meeting with her weekly and diving through all of these topics. She's so well prepared, and it's delightful to see all the services that are being pulled together under this particular department, but as John said, really affecting the entire district. So you should feel very proud of your efforts. Certainly, especially in this COVID time period. Can you imagine Director of Health and Wellness? What more could we need? Of course, academics, but those tie in hand, as we know, for student success. So thank you for being a great listener and a great collaborator. It's been a pleasure working with you thus far and years to come, I hope.
Thank you, everybody. I appreciate working with all of you and all of the district administrators, staff, and even those that I haven't met with. So I'll continue to work. Thank you.
Thank you. And I can't believe it's been only that long. It seems you've been here with us for so long, and it's only been a few months. You've done so much. Thank you again. Okay, moving on to 10.1. Oh, we just covered that. Sorry. 11.1 correspondence.
Just the emails that I think not all board members received, but 2 of you did along with myself. So
Okay. See, 12.1, possible other business suggested items for future agendas. None. Okay. Changes to the board agenda schedule or items. That's 13.1. No changes. Okay. And with that, can I have a motion to adjourn?
Hey, so moved.
Second.
All those in favor say aye. No roll calls. Thank you, everybody.
Bye.
Bye,
All right, good night.
Elisa. Good night.
Bye. I'll see you in October.
Okay.